Hold on. Let's see if I can prop this up. Okay. I'm gonna fix your glove, not your glove, but your hand brace. So yeah, these braces, they make it where their hands can. I know, baby. I know. Tell me everything, Jay. I know, baby. I know. I love you so much. I'm so proud of you. I know. I wish I knew what you were saying, but I know you telling me you love me for one. I know it. It's good. You're a big boy. I'm proud of you.
Hi, how's it going?
I think, wait a minute, did you boo-boo, Jay? Is that what so I'm thinking he's telling me he loved me, but you boo-boo and it smelled like, did you boo-boo? I think you did. Yeah, I think you may have boo-boo.
Well, as Nurse Snow, we get
Yes.
all cleaned up. He has a room that's almost ready upstairs on the 8th floor.
Yeah.
So you guys are getting promoted out of the ICU.
We graduating again.
And you're gonna have a more comfortable. You know, the rooms have a couch that pulls out like a futon.
Yay.
There's your own private bathroom. There's just
Yay.
much less noise and alarms and things like that. And so I think the ICU is like all in all is a promotion.
Yes, absolutely.
I think that the endocrine doctor, Dr. Brady, had talked, which they're like the diabetes team, had talked to Dad about how his blood sugar levels have just been high since he's been with us.
Okay.
And we had him on and off the insulin drip, and sometimes that happens right at first when you have an injury, but then it usually gets better. And for him, his blood sugar levels have stayed high. Hey, bud. And so we sent, I know you're scooting over there. We sent some labs to look for to see if he has diabetes or early signs of it, and he is pre-diabetic. His blood sugar, I know, so kind of like one more thing, but his hemoglobin A1C, which what that is it looks at, so sugar sticks to your red blood cells, and your red blood cells live about 3 months, 120 days.
Gotcha.
So we can take a sample of blood and kind of spin it out and average how much
Before
sugar
the
is.
actual accident, y'all were able to.
We can get an idea of what his blood sugars have been for the last 3 months.
Gotcha.
And that's what we look at, and that's what we use to measure diabetes, because we look kind of a 3-month average. And if people are controlling their diabetes better or they're getting healthier, then that number goes down because there's less sugar on your red blood cells.
Gotcha.
6.5% is diabetes, and he is 6.4%.
Okay.
So he's right at that cutoff. And so rather than, let me get gloves, bud. Rather than get him he doesn't need to do
Insulin.
every meal yet. And hopefully we avoid that. But we are going to start him on a once a day medicine called Lantus. It's a long acting insulin. And how that works is that it just sort of it stabilizes his insulin levels.
Gotcha.
So it tries to prevent you from having lows or highs, and just tries to kind of bring it down more. And so it doesn't work. I know you've been coughing more today, but it doesn't bring it down like right away. It works really slowly. It actually lasts 24 hours.